took part in the Primary Health Network's Allied Health Coaching Program because my role was changing in the practice from a clinical role to more of a leadership and mentorship type role, and I really wanted to sort of create some structure around that and get some information that would help me to fulfill that role.
I saw an opportunity to gain more skills, but because most of my role with my patients is a coaching role, I thought that I'd be able to learn more, which would benefit my patients and myself ultimately.
I thought it would be something that might help in my professional life.
I thought it would be a good opportunity to hone my leadership skills, learn how to affect change and bring others along with me, and also instill value into the organisations that I am involved in.
I found it extremely helpful, and it gave me a place to figure out what areas to concentrate and grow and build confidence.
I enjoyed the way that it was set up. It's a very, very good online program, and I could do it at my own pace.
The flexibility, the available sessions.
I really loved the 360-degree evaluation at the beginning, as I've never had the opportunity to do this before. So the 360-degree evaluation is where your management and your leadership skills are assessed by your peers, those below you in the organisational structure and those above you. It really helps you identify what you need to work on as a leader, and I liked how it kind of made me feel challenged and ready to question how to approach certain situations, and also what were the barriers to moving forward with things such as succession planning.
The other thing that I got a lot of benefit out of from was the face-to-face meetings I had with a coach. They were great.
By talking through some of the things that I wanted to focus on and ideas I had that were in my head then became more substantial because they were then out there in the open, and you have to be able to articulate what it is that you want to do to explain it to someone else.
It allowed me to just concentrate on the skills that I wanted to grow on and improve and being an effective leader.
There were some interesting exercises, some self-reflection, and also exercises which gave me the opportunity to understand how to implement some of these processes in my new role as more of a mentor.
I was putting into practice what I was learning all the way along, and I have found that really beneficial. Probably the thing that I have found the most beneficial is the information that I got on active listening.
I'm a big believer in reflective practice, particularly as a clinician, but it's helped with being organised and actually being clear about what it is that my goals are and having some strategies.
It helped me to increase my accountability. I worked through how to make people feel more valued and how to give feedback and challenge poor performance, and also how to promote the long-term vision of the organisation.
It also allowed me to identify the things that brought me joy in being a leader and to really focus on working in an environment where I had these opportunities to grow and expand on them.
I recommend it to anybody who's going through change in their job and in their position, and anybody who wants to take on a role of mentorship and coaching for perhaps junior staff members within their practice.
I think anybody who is engaged in face-to-face consultations with patients.
I think practitioners who are in senior positions within their organisations who are required to lead others.
Anyone in a team leader or manager position, or anyone who is running their own practice.
I think it would be suitable for anyone that's maybe seeking some sort of more formalised direction, wants to be able to think through things, be reflective in their work practices, and to evaluate how they're working as a whether it be an independent practitioner, a business owner, a clinician, or even individually, personally. I think coaching it can help in lots of ways.